sometimes when I talk with families about the need to consult ethics, I think that probably sounds fairly scary, like control will be lost. But the reality is the committee is there to help support the complexity of this scenario so that we can really make sure that we're doing the right thing and taking the right course of action.
Welcome to the With You at Every Step podcast, where we address your healthcare questions and help you navigate life's challenges. Our guests share their expertise and real-world advice related to care for older adults, grief and healing, and pregnancy and parenting. Every Step is a nonprofit healthcare and human services organization offering dozens of programs that are there when people need us most. Learn more about our free and low-cost services at everystep.org. Thank you for listening. And here is our host, Holly Carver-Kim.
Thank you for joining us again today. We're talking today with Every Step Medical Director, Chief Medical Director, Dr. Tom Mosier, and we're very thankful to have you back on the show again.
Happy to be back.
Well, today we're talking a little bit about ethics, and I must admit that when this topic came up, I thought, well, that's an easy one. I mean, right and wrong and all that, but there are some very difficult decisions that have to be made as providers and as families that involve ethical decisions. Can you talk a little bit about, just in general, what is an ethical dilemma when it comes to hospice care?
Yeah, it's a good question. We often see dilemmas when a couple different ethical principles are in conflict. For instance, one's right to autonomy, to self-determination, to choosing the path that's right for them, versus possibly our obligation to first do no harm, or to, do things congruent with the patient's capacity. And so sometimes you'll run into situations where a patient who is slightly oriented, but also not fully tracking with the scenario, maybe advocating or asking for things that maybe aren't consistent with what they had said before. Possibly other family members are advocating for things that aren't consistent with that. Maybe it's a situation where they're not advocating for things consistent with what the patient's last known wishes were, and now the patient is no longer able to speak on their behalf. So we run into dilemmas not uncommonly because of those things. And when that happens, then we need to kind of put that through the filter of ethical principles and bring others together, often bring ethics committee members together to talk about everything so that we can make sure we're doing the right thing.
And that's one thing people may not know about Every Step is we have that ethics committee. Can you talk a little bit about what the ethics committee does?
Yeah, no. So our ethics committee is composed of numerous individuals, both from internal to our organization, as well as external community members, professionals from the legal field at times, professionals from other healthcare delivery disciplines. And ultimately, they together have an interest in making sure that they are educated in how to go about an ethical discussion and making ethical decisions from an ethics committee consultant point of view. And when we need help, then we will ask them as a committee to sit and hear the details of the case and help give guidance on any concerns or input they might have from an ethical standpoint.
When it comes to ethical decisions about patients who are in hospice care, one of the myths that I actually thought was true until I learned it was a myth is that morphine hastens death. And I know that that's one of the medications that's used to ease pain when a person comes to end of life. And some families may say, no, we don't want them to die sooner. Talk a little bit about what the actual fact is regarding that.
Yeah, no, it's a good question. So ultimately, morphine, like really most every medication, has the potential to cause harm. Okay. But when used appropriately and proportionate to someone's tolerance, is a very safe medication and does not hasten death. And never would we utilize any medication from the perspective to hasten death. Certainly, there are a few states that do allow for physician-assisted dying after a fairly rigorous process of vetting and approval. But that is not something that is illegal in Iowa, and that is not something that we ever intend to do. So using the medication appropriately, just like using any medication appropriately, is very safe. An example being, if you give somebody too much of a medication for their blood pressure, you could cause harm and you could hurt them. If you give them too much anxiety medication, you could even cause death. So ultimately, there are numerous medications that, when taken in high doses, can cause harm, but we utilize them safely and within very rigorous guidelines to make sure that the therapeutic effect is there, but the unintended harmful effect is not.
And that even goes for things like when you're dehydrated, using IV fluids for a patient who is not eating or is not drinking enough. That's a decision that also has to take in a lot of different factors.
Yeah, absolutely. Pretty much any medical intervention, if applied to the wrong scenario, could cause harm. And fluids are a great example of that. As one is at end of life, their kidneys and heart and lungs are not functioning optimally. And giving them fluids through an IV many times actually backfires on us. It can lead to congestion in the heart to struggle, can lead to that fluid being displaced into one's lungs, making it harder to breathe. And the kidneys can't filter and get rid of that fluid in the same way that they normally would. And so again, that can compound it building. So there are many situations where something that maybe once would have been helpful can actually cause more problems than it solves. So every single therapeutic action needs to really be looked at through the lens of what's going on pathophysiologically with the patient and what is going to be most beneficial.
You know, as I listen to you talk about this, I'm thinking how critical it is to have a hospice expert on your team. If you're caring at home for your loved one who is near the end of life, I can't imagine how difficult these kind of decisions would be without a medical background. And Every Step provides care in the home as well as in our Kavanaugh House home. But I think that this really demonstrates how critical it is to have medical experts helping you guide decisions as a family and a patient.
Absolutely. You know, when I was in medical training, it was very well known and really drilled into me that when you're taking care of children in a pediatric medical discipline, you aren't just taking care of little adults. In other words, children and the medications and the doses and how their body handles those medications is very, very different than an adult. You can't just take their weight and divide it by 2. Their organ function is different. How medications impact them is different. And so you need a pediatrician and pediatric critical care docs, et cetera, when a child is ill. So that's very well known and understood. What I think is not appreciated quite as much is how unique end-of-life care is, and how there is a very unique set of skills and training that a provider would need to undergo in order to be able to be comprehensive and being able to address end of life, because there is changes in drug metabolism, organ function. There are many, many unique things that occur at end of life that change medicine and change how medicines impact the body. And so having individuals on a healthcare team that has training and expertise in how to manage illness at end of life is very, very important.
Another issue that comes into the ethics realm is the diversity of patients. As our population diversifies, we have more patients from different cultures, and then those considerations also come into your ethical decisions.
Absolutely. It's not uncommon at all to encounter individuals who either have had a very hard life and maybe made some poor choices, but ultimately deserve the absolute best we can give them, right? And it's not uncommon to encounter individuals who have very limited resources and access. And so we need to make sure that we are providing for the same standards of care that we would for anybody. In other words, all the judgment goes out the window, and that patient is treated the same that any other patient is. And so, knowing that medical providers are human beings, sometimes it's not easy to filter stuff out. And so we need to make sure that we are using the same standards and the same compassion and the same resources in treatment of all patients, regardless of all of the other dynamic scenarios playing into the situation.
And as we talk through all of this, I'm sure you want to make it clear that the patient's family and the patient themselves, if they're alert and able to take part in the discussions, you don't make these decisions. You don't talk to the ethics committee and then say, this is the decision we've made. You always take into consideration the family, right?
Yeah, absolutely. And really, the ethics committee does not dictate any course of action that must be taken. They are more of a body to guide and to highlight issues or concerns. They give recommendations. But ultimately, part of the ethics consultation is making sure that the patient, if they can speak on their behalf, if they have the capacity to participate, is directly involved and interviewed by members of the ethics committee, as well as any key stakeholders or family members that are involved, that the patient wants involved, or that have been designated to be involved by proxy as power of attorney. So the ethics committee does meet with the patient and or the family in that consultation to make sure they understand all the dynamics that are going on before they render their opinion or guidance.
I'm curious, is this ethics committee that Every Step has, is that a common thing in hospice care, or is that something unique to Every Step?
There are hospices that do have access to ethics committees, but it is not a very common thing to have within an organization. Hospitals typically do have ethics committees, particularly the bigger tertiary hospitals. But ultimately, it is fairly unique for an independent nonprofit organization like Every Step to have their own ethics committee.
Anything else you want to add about these decisions that are made and how you weigh the ethics of each situation?
I think it's just important to stress how much the ethics committee is an extra layer of support for difficult decisions, not a trump card for that decision. Sometimes when I talk with families about the need to consult ethics, I think that probably sounds fairly scary, like control will be lost. But the reality is the committee is there to help support the complexity of this scenario so that we can really make sure that we're doing the right thing and taking the right course of action.
It's just another tool to help make sure that everything is handled in the way that is in the best interest of the patient.
Exactly.
Thank you, Dr. Mosher, for being with us again today. We always appreciate your insight. If you have any questions about hospice care or any of the services Every Step offers, we encourage you to go to our website at www.everystep.org/care. That's everystep.org/care. Thanks again for tuning in today, and I'm Polly Carver Kim.